Dr. Alexandra van der Woerdt is board certified by both the American and European Colleges of Veterinary Ophthalmologists. She came to AMC in 1994 and heads our ophthalmology service. Dr. van der Woerdt also serves as the Director of Postgraduate Education at the Schwarzman Animal Medical Center, and we are so grateful to have her for making the time to lead tonight's event. Please welcome Dr. Alexandra van der Woerdt.
So welcome everybody to tonight's discussion. It's about vision loss in dogs and cats. And before I really dive too much into it, I just want to introduce our ophthalmology service. This is myself. I've been here for a while. Like Kimberly said, and like Michelle said, we've been here for a while, but I could not do it without him, Mr. Thomas Hall. He's my technician, a licensed veterinary technician, and Mr. Peter Pineda, he's my assistant. They both of them make the service work. And then the final person that is added is Miss Monique Gonzalez. She's really instrumental in making sure that everybody gets seen when they need to get seen, because as some of you may have experienced, I book out quite a bit in advance, and she can sometimes be on top of it and know when there's cancellations, and then people get in much sooner than they normally would. So we go into vision loss in dogs and cats. What are we going to talk about? A little bit about the history. And then we're going to look at a brief anatomy of the eye. And then we're going to talk about the causes of vision loss. And that can mean the eyelids and the cornea, the anterior chamber of the iris, the lens, the fundus, glaucoma, and also the brain has to work to be able to see. So neurologic disease can do it as well. So history, we talk about history. These eyeballs, I would say, look beautiful. So that's good. So history, what's important in the history is the loss of vision. Is that a slow, gradual loss of vision, or is it a very sudden loss of vision? There are some diseases that are associated with a slow, gradual loss of vision, like retinal degeneration. And there's also diseases that can be associated with a very sudden onset of vision, like other types of like retinal diseases. Can also be a difference in day versus night. Some diseases have, especially initially, a decrease in vision at night, and some of them you have more of an issue at day. Sometimes everything seems okay, but it seems to transition from the bright to the dim light. That's when animals really have a tough time. Or the opposite, they go from the dim to the bright, and then all of a sudden it's all of a sudden very, very difficult for them. Also think about the task of the animal. You can't see her right now, but right now I have a little poodle sitting on my lap. She's kind of out of the field of view, but her task is really to keep me company, to be cute, to be a little bit of a brat sometimes, but that's her task. Truthfully, it's great that she's got two beautiful normal eyes, but even if she would not be able to see very well, she can still perform those tasks very well. Now, think about a dog that is mostly like a hunting dog or a seeing eye dog. For them, vision is extremely important, and loss of vision might be more devastating for them. Cats, I put cats on there with an exclamation mark. Cats are amazing at hiding a loss of vision. If somebody tells me their cat doesn't see well, I absolutely instantly believe it. Because cats are so good at hiding vision loss that if the owner notices anything, that usually means the vision loss is pretty advanced, or they might be already completely blind. I've also known blind cats who still jump on top of a huge refrigerator. They are truly amazing. So if we talk a little bit about the eyeball as far as the anatomy, then we have the eye. This is a cross-section through the eye where the eyelids are not in the picture, but here we have the cornea. The cornea is very important for a normal refraction of the light. And then the cornea is normally very clear. The anterior chamber is the distance between the cornea and the iris. And then, of course, we have the iris right there. That's the brown or the green or the yellow or the blue part of the eye. And then we have the lens here, which focuses the light onto the retina. And then we have the fundus here in the back of the eye, and that is the retina. If we start a cause of vision loss for the eyelids, there's one condition called entropion. And what that means is that the eyelids are rolling in and the hairs are directly irritating the cornea. So if you look at this picture, this looks pretty normal. This is not supposed to be like that. The hairs, the eyelids are rolling in, and because of that, the hairs are directly touching the eyes. Now imagine having hairs constantly rubbing over your eyes. You and I will be like incredibly uncomfortable, and we'd be like holding our eyes closed. Just imagine having one hair on your eye. Now imagine having these all the time. Of course, that's a painful disease. And that can be a hereditary condition like we sometimes see in dogs, or it can sometimes also be secondary to something else. Dogs is usually hereditary. Sharpies we don't see as much anymore, but I would say 10, 15 years ago, I saw a lot more. They are frequently born, almost born with entropion. They have very, very severe rolling in. But there truly are many other breeds. It tends to show up at a young age, like the Labrador, like 1 to 2 years of old age. Some of them, it shows up as a puppy, no doubt about it. But it can also be secondary to other painful surface diseases, because what happens is dogs and cats can do something that you and I cannot do. They can actually actively pull their eye back into the socket. Now try doing that yourself, you can't. But a dog and a cat can. And what happens is if an animal has something painful in the eye, and then they really close the eyelids very tight, and they pull the eye back in the socket, guess what happens? The eyelids lose their normal support and they start rolling in. So then at that point in time, you get entropion, and that is irritating. So guess what happens? The animal even squints more, and they pull their eye further back in the socket. And then all of a sudden we have this vicious circle where the animal is incredibly painful. And sometimes if you correct the underlying thing, then the entropion can resolve. So if entropion is severe and bilateral, it can be blinding. You can't see if you can't open your eyelids. So in cats, it's frequently secondary to something else. Either they have like chronic holding their eyelids closed because of like a severe feline herpes virus infection, or sometimes in the older kitty cats, the true senior citizens, like the 16, 17, 18, 19-year-old cats. It's not uncommon that there's normally a big fat pad behind the eye. As the animal ages, the fat pad can start to resorb, and because of that, the eye can start sitting deeper in the socket. And then secondary to that, the eyelid can roll in. How do we treat entropion? If it's very mild, we might be able to get away with just a little bit of a lubricating ointment a couple times a day on the eyes. If it's more significant, then we want to do surgical correction. The reason why I put filler there, if we have, again, this 18-year-old kitty cat, we really would rather not put that kitty cat under general anesthesia. But we do want to do something. So sometimes we inject some of the fillers that is used in plastic surgery in people, and we can actually inject that in the eyelids to kind of like puff them up a little bit and correct the entropion. It tends to be temporary and it's not a permanent fix, but this happens in the older guys. And a lot of times, once or sometimes maybe with a repeat, you kind of make sure they're comfortable for the rest of their lives. Now, there's also dogs like this. Now, this one is actually not so bad, but there are certain breeds like the Bloodhound and some others where they are born with these huge eyelids. And then sometimes in the breed standard, it says that the red needs to be seen. They're called diamond-shaped eyelids because they're kind of like, I guess a diamond. And sometimes it gets so bad, they're so big that this upper eyelid starts sagging over, and it gets so bad, especially if they have significant folds in the forehead as well, that everything starts drooping over their eyes and they can't see. So those definitely need surgery. So moving on to the next part, cornea. And I just want to let Miss Lifer know that I don't have any clock here, so I have no clue how I'm doing on time.
Doing
So
great.
I know
Well,
around like 7:35 or so, come check on my office and let me know.
I will. Okay.
Thank you. So if we talk about the cornea, the normal cornea is transparent and dehydrated. So this is a picture of an eye from a previous dog, a greyhound. And basically what you see here, you see the iris, you see the lens, you had a little bit of cataract as she was starting to get older, but you really don't see the cornea because you normally can completely see through that. And the normal cornea is transparent and dehydrated because there's a very specific arrangement of how the cornea is put together. There's normally no blood vessels in there. There's no pigmentation. And on the very inside of the cornea, there's a single cell layer that keeps the cornea in a permanent state of dehydration. So all these things work together to keep the cornea clear. So if you stop messing with that, that's when you can get a more cloudy cornea. So some of the things that can happen, you can get a corneal ulceration, where basically you get like a scratch on an ulcer on the surface. If it's just superficial, it can heal very nicely. This one is more deep and it does not look very good. This one actually needed surgery to be able to get it to heal. Sometimes if corneal ulcers get to be very severe, they can actually be so severe that they go all the way through the cornea. And then we have what's called the corneal perforation, which is basically a hole in the cornea. And sometimes the iris, the brown part of the eye kind of like rushes in to try to plug it up. And that can sometimes work well, like happened here, but in the whole healing process, the eye manages to heal itself, but vision is lost. And if we look at this eye, this was basically the perforation, but we also see a cataract behind there. So this eye is comfortable, but it didn't have that vision. Another reason why it can simply be that you can't see because of the cornea, if the cornea has built up so much scar tissue that it completely lost its transparency. There's also conditions in which the cornea develops a lot of pigmentation, a brown film on the surface. The pug dog is very well known for no reason, just building up pigmentation. And it typically starts here in the inner corner, and it gets worse and it's worse. It's usually a triangle. It gets worse and it's worse, and it gets worse and worse until finally it takes up the complete cornea and it makes them blind. Now, you can also have secondary to chronic dry eye. And this is actually a dog that had chronic dry eye and was not treated for it. And then secondary, dry eye is very irritating to an eye. So the eye kind of protects itself from that dryness by building scar tissue to make it a whole more tough, very much a tough structure. But that, of course, is not good for transparency. So as things go on, you slowly, gradually start to transform this very nice, clear, transparent tissue into a much tougher piece of tissue that has a lot of pigmentation. It is much tougher, so it doesn't get as easily damaged because of the dry eye, but you do lose transparency, and if it's severe, it can lead to blindness. This is a kitty cat, and this is something that's fairly specific for a cat. We sometimes also see it in the horses. It's called eosinophilic keratitis. Now, what that is, it is sometimes in cats for no real apparent reason. They start building up all this inflammatory tissue, and it can start going all the way through the cornea. And although it usually is not blinding until very late in disease, I have seen it blind kitty cats. Good thing about this is this can be treated, but if we don't stick with the treatment, it can recur. Neoplasia of the cornea can happen, but is fortunately pretty rare. Now, I mentioned that the cornea normally is kept transparent because on the very inside there is a single cell layer that constantly pumps out fluid. Now, you are born with a certain number of cells, and what you're born with is pretty much what you're going to get. There's very little replenishment of these cells. Everybody is born with more cells than they need because during life, there's some degree of cell loss, which is usually you have enough cells that you can deal with some cell loss. Some people, some dogs lose that many cells that the remaining cells cannot do the workload. Then you get a progressive accumulation of fluid in the cornea. And that is what is depicted here. Now, extra fluid in the cornea can have a lot of potentially bad reasons as well. Glaucoma is a reason for extra fluid, a high intraocular pressure. Uveitis is inflammation of the iris that can cause edema as well. A luxating lens can cause edema as well, and corneal ulceration can cause edema as well. So this kind of cloudy look, if you see that in one of your pets, it's definitely worth checking out. The corneal endothelial cell degeneration is what I said, it's a progressive loss of endothelial cells. So you get progressively more fluid in the cornea. There's not really any great treatment for that. If this happens in a person, you go on the list for a corneal transplant. And although corneal transplants are sometimes done very early in disease, it's not a common thing that is done, and most people don't. And one of the good things about this is that the loss of vision is usually not until very late in the disease. Now, if you move beyond the cornea and go into the anterior chamber and the iris, again, that's the distance, the area, the space between the cornea and the iris. And that's normally filled with clear fluid, completely transparent, you look right through it. Vision can be impaired if there's abnormal cells. Like right here, this eye is filled with blood. It's called hyphema. That you cannot see through. Anytime you have hyphema, blood inside the eye, it can be either secondary to systemic disease, like for instance, high blood pressure, especially in older cats, or it can be secondary to other eye diseases as well. And actually, let me just go. Okay, let me just talk about that a little bit more. Because again, if you have blood in the anterior chamber, it can be secondary systemic disease, also such as, for instance, like rat poisoning, or like certain tick-borne disease, Lyme disease. Like I said, high blood pressure in cats is not that uncommon as cats age, and sometimes it's not noticed until you see this, where all of a sudden the eye is just filled with blood and it looks very, very scary. The blood in itself is not painful. Like this is not a painful eye, but of course it's very important to try to figure out what is the underlying reason for that. Oh, so we'll go to this slide. Anterior uveitis is inflammation of the iris. And with the inflammation, inflammatory material can be within the anterior chamber. There's not so much here, but sometimes this whole area is just fuzzy, it's foggy because it's just filled with inflammatory material. And it makes it very hard to see the back of the eye. Well, if I have a hard time seeing the back of the eye, the animal probably has a hard time seeing out. And it's not uncommon if you have uveitis that the pupil becomes very small, called miosis. Was not in this kitty cat, because this kitty cat, that was actually a tumor sitting in there. But inflammation in the eye, that can sometimes be just off the front part of the eye, the iris, but sometimes it's in the back as well, in the choroid, in the retina. And at that point in time, it's more likely to get vision loss. Anterior uveitis, inflammation of the iris, is frequently secondary to systemic diseases. And it can be things like bacterial infections, viral infections, fungal infections, tick-borne diseases, tumors, immune-mediated diseases, meaning that something in the body is setting this off. We may not always be able to find it, but if we treat it, then you can sometimes get vision back. But it's very important anytime you have inflammation inside the eye, anterior uveitis, that you want to look for an underlying cause. We don't always find a reason. And at that point of time, we assume it's something else in the body that's doing it. And then the appropriate treatment is immunosuppression, but you really want to make sure that you really look for another disease and treat that if present. You can also, unfortunately, get tumors growing inside an eye. This one was not blinding yet, but it actually grew pretty quickly and pretty soon started taking up this whole space, making the eye blind. This was a benign tumor, meaning that it didn't spread to the rest of the eye, but to the rest of the body, but we did have to take that eye out. We move a little bit deeper in the eye. Oh, I had to find a picture here. That's my old boy. He's called Hudson. And this is a little poodle that's sitting on my lap right now. The lens is a fairly simple thing. It can only become denser as we age. It can develop a cataract or it can move out of its normal position. So if we talk, this is my boy Hudson's eye. I got him from the shelter at least 13 and a half years ago, and he supposedly was 1 year old. So he's at least 14 to 15 years old, if not older. So his lenses are getting very dense. And nuclear sclerosis is a normal aging change. In the dogs, it starts at approximately 6 years of age. And in cats, it starts later than the dogs. Some people say 9 years old, but that's not as much set. And in people, that's the reason why you reach your 40s, you're going to start needing reading glasses. And as you continue to age, you need them more and more until you're lost without them. And this may look like a cataract if the lenses are very dense, but the animal can see through it, which of course is a big difference from a true cataract. It does start to interfere with close-up vision a bit, meaning that if you have a dog that's senior citizen, meaning 13, 14, 15, don't be surprised if your dog walks to the food bowl and then the last little bit, it seems like he or she needs to use the nose to be able to really truly locate the food. Also, if your dog occasionally runs into something, it's because he or she wasn't really paying attention. Things up close get a little bit fuzzy, so they can sometimes run into something. If you want to give your dog a treat, don't hold it right by his nose. He can't see it. Pull it a little bit further back, and then he or she can see it and walk towards the treat, and then you can give it. So there's really nothing we can do about it other than making them younger, which is just not possible. But there's really nothing that we need to do about that. Now, a cataract is a true opacity in the lens. And there's various stages. Incipient means it's just a tiny small dot. Nobody cares. Immature is a little bit more, but the animal still sees. Mature, which is this eye, means the lens is completely opaque. And hypermature is when the lens starts shriveling up. What happens eventually when a lens sits in the eye, eventually it does when a grape turns into a raisin. It starts shriveling up. And of course, a cataract can start causing loss of vision if the cataract is mature, if it's completely involving the entire lens. In dogs, the most common reason is something in their genes. The age of onset is variable, but it can be very young. I've seen Siberian Huskies and Cocker Spaniels be blind from hereditary cataract before they are 1 year old. And there's many breeds that potentially are affected. The second most common reason for cataracts in dogs is diabetes mellitus. And that can, of course, happen in any dog at any age. And one thing that's fairly characteristic of the cataract secondary to diabetes, it happens very quickly. I've literally seen dogs go from having fine vision to almost no vision in a matter of days. That's how quickly it can go. In kitty cats, this is a kitty cat, the most common reason is secondary to chronic anterior uveitis, inflammation of the iris. Usually it's just one eyeball. Do we see hereditary cataracts? Yes, we do, but they're pretty uncommon. What can we do about cataract? Just briefly, cataract surgery. Now, the first thing we need to do a test to make sure that the retina behind those lenses functions normal, because if it doesn't, taking the lens out is not going to help. So the way that we do that is by doing what's called an electroretinogram, where we test the function of the retina, where this first little thing means that the photoreceptors in the back of the eye are being stimulated by the light, and then the light gets transmitted through the retina, and then some other waves follow. So this is nice. This looks good. We like this. We don't want to see a flat line like that. No good. We also do an ocular ultrasound to check for the presence of a retinal detachment. If we do cataract surgery, we use a technique called phacofragmentation, where with a very fine ultrasound tip, like seen here, it's, oh, that's interesting. A very fine ultrasound tip, we break up the lens, and then the little pieces gets removed from the eye by irrigation and aspiration. And after that, I typically put an artificial lens in if at all possible. And if I a very high success rate for a return of vision, but not 100%, and complications can happen. So this is an artificial lens. I've taken out the cataractous lens there, so you see the nice green reflex. And this is an artificial lens. And then over here, you can see it sitting inside the eyeball. That's cataract surgery. Now, again, the lens can either become denser because it's old, it can get a cataract, or it can shift out of its normal position. The lens is suspended inside the eye 360 degrees with little kind of tiny zonules that are supposed to attach to the periphery of the lens right there. Now, in this lens, it most definitely is not, because this is the lens and it's sitting partially in front of the iris. It's supposed to sit behind the iris, not in front. That's called a lens luxation. Two types. There's a primary lens luxation, and that's a genetic malformation of these little tiny zonules that hold the lens in place. Terrier breeds are predisposed to that, as well as the Border Collie. Secondary lens luxation is secondary to something else, like a high pressure, like glaucoma and chronic inflammation, because it basically destroys the little zonules, or some sort of a tumor that pushes this lens out of its normal position. What do we do with it? We surgically remove the lens. This can be uncomfortable. With the lens sitting right there, that can be uncomfortable. In those, we typically try to remove the lens surgically. So if the lens is located between the cornea and the iris, we tend to want to remove it surgically. If the lens, this is a cataract, and the cataractous lens has fallen all the way to the back of the eye. That's why you only see part of it. If it's sitting in the back of the eye, you may not have to take that lens out because it can sit there very comfortable. And what we do then, we use a medication to keep the pupil small so that this lens cannot come forward. If we move on a little bit more, the fundus, the back of the eye. And there's certain retinal diseases. You can have a loss of function, a retinal detachment. There's a syndrome called sudden acquired retinal degeneration syndrome. Also, we can have optic nerve diseases, optic nerve hyperplasia, glaucoma, optic neuritis. So loss of retinal function. If I just go back one more, this is a normal fundus of a dog. This is a very nicely myelinated optic nerve. You see lots of blood vessels sitting right there. There's some veins and there's some little arteries. And then this reflective structure is called the tapetum, which you and I don't have. But that's the reason why animals, if you look for a deer in the headlight at night, because you really don't want it jumping in front of your car, so you kind of scan the periphery to look for these really bright reflexes. And if you see them, you kind of slow down. That, you see the reflection of the tapetum of the back of the eye. Again, it's not something that you and I have, but most animals do have one of these tapetums. So this does not look normal. The optic nerve, yeah, it's very tiny. This is the only little tiny blood vessel that's there. That's not supposed to be like that. You're supposed to have lots of vessels that come here. And this kind of looks really blah, and there's some pigment clumping there. That is a retina that has lost all its function. And for retinal degeneration, that can be a hereditary issue called progressive retinal atrophy, which is a disease of purebred dogs, and there's a fairly specific age of onset that is very breed specific. For a lot of these, there's genetic testing available, and a lot of progress has been made over the past decade or so in eliminating animals that have the abnormal gene from the breeding pool. So I would say I see it much less than I used to see it in the past, which is wonderful. With the retinal degeneration, we typically have a slowly progressive loss of vision, and it's usually initially worse at night. And then it seems like more and more light is needed for the animal to be able to see, until at some point in time, there's just not enough light in the world for that animal to be able to see. And then we have a blind animal. There's really no treatment currently available, and that is still true for people as well. But, and I honestly don't think it's going to be commercially available anytime soon. Based on some dog experiments and dog models, there's more promising treatments for people, and hopefully eventually they will come back to the dogs, which would be great. It's not uncommon that secondary to that degenerating retina, you get a cataract formation. Of course, at that point of time, there's no reason to ever want to take that cataract out, because like we said earlier with the cataracts, there's no reason to take a lens out if the retina behind it doesn't function. Retinal degeneration can also be secondary to inflammation, and that can be infectious diseases, immune-mediated diseases. Now, this is very much a degenerated retina, and one of the hallmarks is that you can get a lot more reflectivity in this reflective structure called the tapetum. And that's because the overlying retina is thinning, and that's why the underlying shining part becomes more shiny. So what sometimes people notice with animals that have retinal degeneration, that the eyes just seem more bright, they seem more shiny. And that is because of two things. One of them, the pupil simply gets bigger. And the second one is because this retina does become a whole lot more shiny and a whole lot more reflective. But again, this is a tiny little vessel. You're supposed to have nice big vessels. This is not normal. Sometimes if you get a retinal detachment and it reattaches, it can also degenerate. Treatment on secondary to inflammation is just all aimed at the underlying cause. And sometimes you can have inflammatory spots that are localized, like a spot here, a spot here, a spot here. If you treat the underlying disease, then these spots would probably degenerate, but the area in between it might still be okay. And at that point of time, yes, if you were a person, you probably have a little bit of hard time reading a book because certain letters would just be gone, but an animal may be able to function just fine with that. If we talk about a retinal detachment, meaning the retina has come off from its normal position, there's basically three types. There's a tear in the retina, it's called rhegmatogenous, secondary to traction band, and it's called the bullous retinal detachment. Now, a tear in the retina, here is the optic nerve, here's the reflective tapetum, and this veil is the retina. Now, it looks in a picture like it's falling up. Of course, it is not. But the way that our ophthalmic examination happens, you see everything upside down, left to right, inverted. So this is what I would see if I would look at the retina with my equipment. Of course, nothing falls up, everything falls down, but that's just basically the way that we see it. So Shih Tzu dogs are definitely predisposed. It may affect both eyes, but it's not uncommon that the first eye goes unnoticed. Because as long as one eye still has okay vision, usually the second eye, you may not notice anything until the second eye goes as well. Surgical reattachment of this type of retinal detachment is possible, but sooner is better than later. You can
Dr.
also
Vander,
have, yes.
sorry, just want to give you a heads up. It's 6:35, but keep
Thank
going.
you.
This is great.
I think we're good on time then. And you can also have a secondary retinal detachment secondary to traction bands. It basically means that usually after severe bleeding in the vitreous cavity, there's like all kind of scar tissue, and the scar tissue attaches to the retina. And then scar tissue at some point in time retracts. It contracts to become smaller, and then it starts pulling off the retina. Treatment is usually not possible for that. And then the third type is a bolus type of retinal detachment. And that basically means there's fluid forming behind the retina and is pushing the retina off. Older cats, a very common reason is high blood pressure, systemic hypertension. Can also be their own immune system doing that in dogs. And this was a kitty cat. The blue iris kind of gives it away that this was a Siamese. This is a kitty cat. And you can see the retina right here. You're not supposed to be able to see the retina without any kind of like specialized equipment. But we could just simply see this retina because it had come way forward. And this was a kitty cat, completely blind, very high blood pressure. We started treating the blood pressure. And then what was great is that vision would come back. Vision did come back. Unfortunately, the owner at some point in time just got too busy and kind of forgot about the treatment. So the kitty cat redetached again, came back again. We started on medication and vision improved again. And at that point of time, he kept it on medication and kitty was visual for a long time to come. So the treatment of this type of retinal detachment is really aimed at treating the underlying disease. Surgical reattachment is not indicated. There's really nothing you can do about this surgically. You need to treat the underlying disease. We talk about surgical correction. If you have a detachment secondary tear like this one, approximately 70 to 80% regain some vision. If you have a bolus detachment, the medical treatment and you treat the underlying disease medically, then it all depends on the disease process whether or not we're going to get vision back. We certainly could. Certainly hypertensive kitty cat, high blood pressure, you control the blood pressure, vision can come back. If the immune system causes all kind of fluid production behind the retina that pushes the retina off, and you treat that, vision may come back. It does not always, but it certainly does not mean that if a kitty cat is blind, secondary to high pressure and blood pressure, that we're always going to be blind. Vision may come back. And there is a weird disease called sudden acquired retinal degeneration. We don't understand it. I stole this picture from the internet. The predisposed breed is the dachshund, the miniature schnauzer, and in general speaking, the small breeds are predisposed. It's typically a very sudden loss of vision. It can be as quick as overnight. It can be up to about 2 weeks or so. It's typically the middle-aged, older, female spayed animal that is predisposed. And around the time or shortly before the vision loss, they may have had an episode of increased drinking, increased eating, which sometimes mimics a disease called Cushing's disease. And then all of a sudden they lose their vision. If we look at the eye as an ophthalmologist, you may recognize this back of the eye. The eye looks completely normal. It looks like it should function just fine, but it doesn't. And the only way to truly diagnose this is by doing the electroretinogram, which again, we did that prior to cataract surgery. And typically in sudden acquired retinal degeneration, there's no function whatsoever. Now, if it turns out that actually an animal lost its vision acutely and we did an electroretinogram, the electroretinogram was completely normal, then that means it's neurologic disease. Sudden acquired retinal degeneration, we still don't know what does it. It is probably some sort of immune-mediated etiology. Treatment is very controversial. Sometimes people do aggressive immune suppression. There are some animals that may regain some vision, but then again, these are very highly toxic medications, so there certainly is pretty significant chance of significant side effects as well. So treatment is controversial. There certainly is no straightforward treatment for that. If we go a little bit further back in the eye, in the optic nerve, This again is a normal optic nerve, nice and big, nice and pink. Now, if you look at this, you follow the vessel here. You see this tiny little black thing? That is the optic nerve. It's called optic nerve hypoplasia. And the dog that's on my lap, a miniature poodle, is predisposed. She doesn't have it, but as a breed, they're predisposed. They're born with it. And it, fortunately, is usually only in one eye. So they're basically blind at birth in one eyeball. And a lot of these animals are born with it because they're born off with, they may not show anything. And it may not be until much later in life when it just all of a sudden as an incidental finding is found. They're born with it. There's really nothing we can do about it. There is also nothing we need to do. These eyes are comfortable. They don't function, but they're completely comfortable. There's other optic nerve diseases as well. Glaucoma, optic neuritis. Now, glaucoma, and he reminds us that it's always good to take a snack break. So glaucoma is a high pressure in the eye. And what that is demyelination of the optic nerve. Not that uncommon in people as we age. And in people, it is frequently easy to control with eye drops. And latanoprost is one that's commonly used. Glaucoma in pets is very different from people. And the dogs, if we talk about it in dogs, is usually very acute onset with immediate loss of vision. If we treat it very aggressively, vision may return. Kitty cats are different. This was a kitty cat. It can be very slowly progressive. And sometimes these kitty cats don't come to me until very late in the disease because they really didn't show anything until very late in the disease. Glaucoma is not a good disease. It's very quickly blinding and it's painful. If the pressure is really high in people, it gives them a headache. Two types. Primary glaucoma, where we have an abnormal drainage angle. The animal is born with an area in the drainage angle is the area through which the fluid normally disappears from the eye. If you're born with an abnormal drainage angle, then you are at risk for getting glaucoma later in life. That tends to be in both eyes, and it can be seen in many breeds. This is a special imaging technique where we have the lens here, and we have the cornea here. Oh, that's weird. Are all these red things showing up for everybody?
Yes, I think if you right click and so it's the pointer.
We'll ignore them.
Okay, we'll ignore it. I'll fix it in the recording. It's okay. You're drawing pictures. It's okay.
Oh, yeah, I didn't quite mean to do that. Thank you. But anyway, this is a drainage angle through which the fluid is supposed to disappear. Now, secondary glaucoma is secondary to another disease, like inflammation or lens luxation. What do we see in the dog? Acute loss of vision. And that may go completely unnoticed if the first eye is affected. But a lot of times these animals are not feeling well. They have a headache. They're not feeling well. They're mopey. They don't want to go out. They don't want to eat. And the eye itself is very red. It's got a cloudy appearance with a big dilated pupil. How do we diagnose it? We measure the intraocular pressure. And we use the tonal pen here. Tonal vet is another measurement. Normal intraocular pressure is about 10 to 20, but there are many variables to take in consideration. For instance, as animals age, their pressure naturally drops. So if you have an animal that's 15 and we get a pressure of 6, that's fine. We need to be very aggressive with eye drops, potentially intravenous medications. We also potentially may need to do surgery. Like this is an example of an eye that has a glaucoma filtering valve, where we put a little valve under the tissues that line the eye. And then we put a little drain right in the eye to try to give an alternative outflow pathway for the fluid. We need to frequently monitor intraocular pressure. And if we have primary glaucoma, remember both eyes are at risk. Even if the one eye is still okay, we do want to start drops to try to delay the onset as long as we can. If vision is permanently lost and the eyes are comfortable and well controlled, we can continue medical management, or do something surgical. This eye dog unfortunately had to lose both eyes. This eye was removed. This one had an intraocular prosthesis. Sometimes what we do is called a chemical ablation, where we basically inject a certain substance in the eye to try to destroy the tissues that produce the fluid. Nice thing about that is I can usually do that with just a sedation, and it's highly successful. Glaucoma in cats, much less common. Vision remains much longer, and we usually treat them with topical eye drop. Now, this is pretty dramatic, of course, but that's not that common. Okay, we move on to neurologic disease, and no, this is not the way to look at an eyeball. So, back in the eye, optic neuritis, an inflammation of the optic nerves. Those are the nerves that are going to transmit the signal from the eyeball to the brain. And if they're all inflamed like that, they cannot transmit that signal very well, resulting in blindness. That can be infectious. This was a kitty cat with cryptococcosis. Can be immune mediated, maybe one eye, maybe both eyes. If properly treated, vision may return. Just to compare, this is the one we just saw. This is a normal cat. Now it's a Siamese cat because it doesn't have much pigment, but this is a normal optic nerve. And this is definitely not normal. It's very fuzzy, it's very angry, it's very inflamed. Neurologic disease can also be brain disease. And that can, of course, be inflammation, potentially a tumor. Treatment may be possible, but it all depends what is the underlying disease process. And for that, we often need advanced imaging. Prior to that, we always do an electroretinogram first, just to double check and make sure it's not something in the brain. But oftentimes we need something like an MRI. Few words about blind dogs and cats. They really adapt very well to blindness. Even a combination of blindness and loss of hearing, they can adapt to that. It's more difficult than just loss of vision, but they can adapt to that. If there's another animal in the household, frequently they will start using that animal as their seeing eye dog. They start following it. And certainly I've heard of blind dogs just like running along the other dog to the front door and start barking just as the other one did because there's something to bark at. Now, acute loss of vision is much more difficult than a gradual loss of vision, and that makes perfect sense. So sometimes these dogs with acute vision loss, like secondary to glaucoma or secondary to SARDS, they really go through an adjustment phase. But give them time, give them love, and they will get through it. There's devices on the market like a halo, which is basically almost like a bumper guard. And some animals do really well with it, and some of them actually really don't want to walk with it. And there's some that really don't mind occasionally bumping into something because they use it as yet another way to figure out where things are. And there's others that are a little bit more timid. There's also some good books on the market. There's a book called Living with Blind Dogs that has some good training tips in it. So vision loss in itself is never a reason to consider euthanasia. In all my years of doing this, I've of course encountered a lot of blind animals. And I would say it's the rare exception where the dog or the cat does not adjust to his blindness. The very few exceptions have been like hunting dogs whose only job was to hunt. That's the only dog that I can remember that truly did not adjust, but everybody else has always adjusted. So we go to this. Any questions?
Well, thank you so much. If you want to unshare your screens, we can see you. This was a wonderful presentation, very comprehensive, and thank you. I know you created this especially for our viewers, and I appreciate the time that you put into that as well. So we do have some great questions. We'll start. Why does diabetes cause cataracts in dogs but not cats?
Excellent question. The reason for that being is that there's a certain type of enzyme that is not working very well in the dogs with diabetes. And because of that, how should I put this? There's a certain enzyme that shuns the excess glucose and diabetes into a product that cannot metabolize very well inside the lens. And because of that, it starts accumulating in the lens and it starts swelling and it starts disrupting the lens fibers, and then they become a cataract. Think of a normal lens as a raw egg white. You can see through it. Think as a cataract as a cooked egg white. You can't see through it. So the cats lack that enzyme to shunt it into that pathway that leads to the creation of sorbitol and therefore opacification. So that's why typically diabetic cats, you don't have to worry about it. Diabetic dogs, you do.
Okay, oh, great. Let's see, okay, how should we be checking our dogs for eye issues? What should we look for? Any obvious signs?
Obvious signs for any kind of eye issue, of course, changes in vision, but then also more obvious things. Chronic redness, discharge, squinting, those are really the more common things.
Okay, great. And I had a question, the difference between, I guess, enucleation versus evisceration, when that's done and why?
Enucleation means that we take the entire eye out and then we suture the skin closed. So you get a continuous layer of skin, let that heal, and then you're done. Evisceration and intersclerosis, what that basically means is we open the eye, we take all the contents out, and then we put a filler back in place again. And that is just basically for cosmetic reasons. And that's in the one slide where it was. And that's called evisceration and intersclerosis.
Okay, great. Do you recommend that vision exams for older dogs as a standard, as standard? Not really.
Not necessarily.
Okay.
I would say, like I said, there's some change you can expect as the animals age. Close-up vision is not as good. Also, the peripheral and night vision typically decreases as well. That is to be expected. If you kind of see a little bit of that, that's okay. If it seems like more than that, then we need to examine it. But if there's no significant concern, then I don't think it's necessary to check the animals routinely.
Okay. Let's see. Can you tell if blindness is due to immune-mediated retinitis or cancer?
That is a very complex question and a very complex answer that I could probably fill an hour. So
okay, that'll be the next
go
there. Okay. And I'll just let everyone know that Dr. Van der Woerdt has also done a whole lecture on cataracts and on red eyes for us. So we'll send you those links tomorrow when we send the one for this one tomorrow, because those are excellent as well. Why are some breeds predisposed to eye diseases? Is it genetic, or are the underlying diseases genetic? That's interesting.
There are some diseases that are that do have true genetic basis. Like there are certain hereditary retinal degenerations. They are truly genetic. There's also some dogs that have a genetic predisposition to cataract formation. And there's also some things that are just simply conformation related. Like if you've got a dog that has no nose whatsoever and these very, very prominent eyeballs, yes, they're going to be more likely to get corneal ulcerations, irritations, things like that, than, for instance, than your average Labrador, which has an eyeball that is better protected by his eyes. So some things are genetic, and there are some that are simply just related to the way that these animals' heads are shaped.
Okay. Should we be cleaning our dog's eyes, and how do you recommend doing that? When we walk around and there's dust flying in our eyes, should we be worried about our dogs as well? And how do you should we clean?
Yeah, it's cleaning it's kind of as needed. If you see no discharge, if the eyes are nice and open and comfortable, there's nothing you need to do. If you see a little bit of discharge, you can use basically just like a moist warm washcloth or something like that to clean it. If it seems like the discharge is becoming more persistent, then there might be an underlying something going on and might be worth having it checked out.
Okay. Okay. So this question is interesting. Can a cat go blind if they live in a dark apartment?
Yeah. Yeah, they can still get all
Really?
the other diseases. Yep.
Okay. All right. But it's not necessarily that it's going to cause it for sure. Yeah. Let's see.
There's a lot of questions, Robert.
Yes. Okay. My dog has diabetes and is blind. She sleeps with her eyes open since she became blind, and her eyes are always red. We currently use Optimune eye drops, but her eyes are still red. Any advice or tips? I guess, yeah, if they're sleeping with their eyes open, is it?
Well, it could be one of two things. It can either be indeed secondary to with the eyes sleeping open, the eyes can dry out. So you can see if adding some like artificial tear ointment, which you can just get over the counter a couple times a day, might make a difference. If it doesn't, then there's a pretty good chance that the eyes may have some inflammation secondary to the cataract, and that needs specific treatment. So try the lubricating ointment. If that doesn't work, have it checked for inflammation secondary to the diabetes, to the diabetic cataract.
Okay, great. We also did have a question about over-the-counter eye drops earlier. Are those okay, or in what
Yeah, I mean, you can use over-the-counter eye drops for pets. That's not a problem. Just make sure you stay away from any kind of product that says it gets the red out, because that usually has medications in it that constrict the blood vessels. And although they may not necessarily be harmful, you really don't want that. So get something like a Gentile or like a Blink or something like that. That is just basically a nice artificial tears, and you can definitely use that for your pets.
Okay, great. That's good to know. Okay. My dog is a 12-year-old long-haired Chihuahua. He has been diagnosed with retinal degeneration, has a cataract in one eye. I'm wondering two things. Is there a larger chance of glaucoma, and what can I do to help him feel his best self as his vision diminishes?
Well, these eyes, are they at risk potential for glaucoma? Yes, they are. Glaucoma is a potential complication secondary to cataract and a potential complication secondary to retinal degeneration. So it would be good to have the eyes checked for like glaucoma like every 6 months or something like that. And just be aware of some signs of glaucoma like chronic redness, chronic irritation, and you may have it changed. And as far as like helping your dog adjust, most of it is just intuitive and common sense. It's like you want to make sure that your animal can't hurt him or herself. So kind of like look at your dog's eye level around your apartment or wherever you live, and make sure that anything that has like a sharp point sticking out is either removed or is covered up. So there are two things that you have to be careful with as animals lose their vision. One of them is a pool. If you're lucky enough to be able to pool, blind dogs, for whatever reason, have a tendency to fall into swimming pools. So be careful. And another one, of course, is stairs. You want to put a baby gate at the top of stairs. You do not want to risk them falling down the stairs.
Great. Great information. Let's see. Are there foods that are recommended to aid dogs' eye health, like carrots or blueberries?
Not necessarily.
Not really. Yeah. Let's see. How about steroid-induced cataracts? His vision is already a 14-year-old dog. Steroid-induced cataracts. His vision is already severely compromised. Should I consider having his cataracts removed? He has diabetes, a heart murmur, and an enlarged heart, Addison's disease.
Sometimes cataract surgery in dogs is a big deal. Requires general anesthesia, requires lots of aftercare. And 14-year-old to me is not that old, but it's not young either. So sometimes you indeed need to look at the whole picture with the heart murmur and all these things. Can they withstand several hours worth of general anesthesia? And in some animals, you go like, yeah, it's okay. We can do it. And there's others where you go like, you know what, let's not push our luck and let's not put them through a big surgery like that.
Okay, great. Would a cat suddenly go cross-eyed numerous times a day and staring in the wrong direction, with his weights often showing to could be a potential vision or neurological issue.
I would say that kitty cat may need to see a neurologist.
Okay. My 14-year-old miniature poodle, has a constant black moisture in the corner of his eyes. Let's see, he's fairly large. He has fairly large cataract. Should I consider some kind of cleanser for his eyes?
Well, miniature poodles also, I have one right on my lap. Miniature poodles also, they have something that we call medial canthal pocket syndrome. And what that basically is, in the very inner corner of the eye, there's an area through which there's a little small opening in the upper eyelid, small opening in the lower eyelid that take care of tear film drainage. In these guys, the poodles that have these long noses, there's kind of, everything is drawn forward a little bit, and there's kind of an empty space in the very inner corner of the eyes. And because of that, the eyes sit deep, and because of that, part of the tear film tends to have a tough time draining. So a lot of poodles, mine included, have this chronic discharge. It's just because these eyes are not capable of draining the tears very well. It's just a matter of keeping it clean.
Okay, great. We have many people saying thank you so much, excellent presentation, and many people saying that their dog is 12 losing vision, and thank you for giving hope and saying that they adjust very well. I appreciate that as well. Thank you so much. And I think with that, we're already over. So again, thank you so much for this wonderful presentation. And everyone, we will send the link out tomorrow, as well as links to Dr. van der Woerdt's other presentations. Thank you, Dr. van der Woerdt, again for this. This is really wonderful. Thank you, Kimberly, for helping to coordinate. And just a reminder, our next event is December 14th at 6 p.m. Dr. Renee Alseroff, it's our book club. And thank you all. That we'll send the registration link out tonight, as I mentioned. And we appreciate you all for taking the time to join us. And we will see you next time. Have a great night. Bye-bye. Thank you.
Bye, everybody.